I've never had doctors be so honest with me about my transition. They pushed me away, girl, but I have faith. I have faith, I have faith.
Can you tell us a little bit about what happened?
A year ago this month, I went to my friend's house. We were playing with the dog, you know, hanging out.
What type of dog?
It was a mixed dog. I don't know if it was...
We don't really know.
Were you there?
Yeah, she was actually with me. Yes, she was
Really?
there. Yes. I just remember literally picking up something from the floor, and then I remember just being in the ER.
So you blacked out?
I don't remember anything.
Do you remember it?
Yeah, I was in the bathroom when the bite actually happened. So I go out there, and my friend's face is missing. So I started flipping out, like, call 911. Ambulance came, they gave me the part of her face, put it on ice in the ambulance.
And was
So
she
you did.
passed
You broke
out?
a piece of lip.
Yeah.
She didn't pass out, but she was in shock.
It's not uncommon for a patient to black out during a traumatic incident. It's kind of the brain's way of protecting itself.
So then at that point, you went to the emergency room, and did they take the piece of lip?
Yeah, I gave it to a nurse.
And what happened? Did they try to put that back?
They had it on ice, and the surgeon tried to replace it, but there was so much tissue damage and nerve damage that he couldn't.
Oh, so he did try putting the piece.
Yeah,
said it was dead.
It was dead tissue.
Okay. So you know he put a flap here.
Yeah.
So what they did was they took a piece of your lower lip and kind of rolled it up to fill that defect.
Yeah.
Before doing an aggressive procedure like that, we would have maybe just put the tissue together and see how it heals, because it does shorten, obviously, the sides of your mouth.
Yeah.
You know, that's really a shame. There's a good chance that Carissa's mouth could have looked a lot better if the doctors used original tissue.
She goes to doctors all the time, and they can't do anything.
Is that what you've been told?
Use her like literally the last hope for her.
It's really hard. It's like, I'm so young, and I don't want to look like this the rest of my life. I don't. I can't really even begin to express how I feel, because it's just been a very long journey for me.
I think the next thing that we need to do is go straight to the exam room.
Okay.
At this point, I really don't know if I'm going to be able to help Carissa. I just hope that her doctor has not done irreversible damage.
My name's Trevor, and my ears hang low and they wobble to and fro. As a kid, I was really happy. When I was in middle school, I decided to get my ear pierced. When I first got my ear pierced, my mom was actually the one that took me to do it. I loved my piercing. A few months into having my piercing, I started to notice and feel this small bump forming on the back of my ear where the piercing was. I didn't really pay too much attention to it until finally I couldn't ignore it anymore, because my earrings wouldn't fit into my ear anymore because it was the size of a pencil eraser. I couldn't get the needle in. We learned that it was a keloid forming on my ear. It's a type of scar tissue that forms in the shape of a ball and progressively gets bigger over time. There are several different ways to remove a keloid, but the way we went about it was just surgically, cutting it off. Everything was fine after the keloid was removed. A year passed, I realized it was coming back, and before I know it, it's the size of my thumb. The second time I got my keloid removed, it was at a oral surgeon's office. The reason why we did was because my mom knew the guy, and he promised her a discount. After I got my keloid removed the second time, everything was great. There was no signs of it coming back. And that's when my killer decision-making skills kicked in and said, oh, I'm gonna go pierce my right ear now. After about a year, that's when I realized the keloid's coming back. Except this time, substantially larger.
My name is Vinny. Me and Brent have a lot in common in terms of him being and me being an alien. We're both striving for a different picture. Whoa. Yes, mama. Yes. That's cool. Dr. Nassif and Dr. Dubrow gave me some advice to stay more natural with my nose. My perfect nose starts out thick from the nasal bridge and comes kind of more down to a point almost.
What you want to have happen, it's potentially dangerous, and it won't actually work.
I will definitely say that I've taken more of a extraterrestrial on Earth kind of look, but always being galaxy realness. Slay.
Hey. Good job, guys.
Woo! Yes! Hi, baby. Oh my God. So glad you came. What a surprise. Just a little moment for you.
Thank you, baby.
Of course. Show's gonna kill.
Okay, you're coming, right?
Oh my God, of course. I'm bringing everyone I know.
Okay. And we have news. We started wedding planning.
Well, hi. Congratulations.
Hi.
You have so much going on.
And you know, my nose has been bothering me. So I'm going to Dr. Dubrow and Dr. Nassif.
We've talked about this several
Yes.
times.
Yes.
But what exactly did you want done to your nose?
Okay, I want the bridge more defined.
Okay.
I want it sharper.
Keep in mind, he's already had one.
I know. I've had about my nose worked on about 5 times, so I
I
got you.
You have to do it until
And
it's
perfect.
right for you.
Since you last saw me, I have had my cheeks, my brow bone, my lips, just, the normal alien maintenance. You are in such good hands. I've never had doctors be so honest with me about my transition to become an alien. They pushed me away, girl, but I have faith. I have faith. I have faith.
I'm so excited.
And they're cute.
Are they?
Yeah, they're kind of cute. Like Dubrow, yeah.
Okay, I'm excited.
I feel it.
And I don't know if I have the complete story straight. Were you riding a moped or a motorcycle?
It was one of the little moped things. I had a fever, so I was going to the pharmacy to get medicine. As I was driving, I sort of passed out. I drove into a steel fence. I woke up, blood was gushing out. I figured out, crap, I've had an accident. There wasn't a plastic surgeon in the hospital, so just a normal doctor stitched it up.
So it's an emergency room doctor, really, right?
Yes.
The emergency room physician was more interested in saving George's life than making his forehead look as cosmetically acceptable as possible. And that's where he should be.
When the scab fell off, that's when I realized there's a gap in between my eyebrows, that I have 3 eyebrows, and that this half of the eyebrow is halfway in the middle of my forehead.
You had this 3 years ago. Out of curiosity, how come you haven't had this fixed yet?
Well, the doctor said for the first year I can't touch it until it heals 100%. And my daughter's 1. I want to fix it before she gets older.
So she says, Dad, what happened to your eyebrow?
Yes, exactly. She still sort of points to it and touches it.
So why don't we go to the exam room and take a look?
Beautiful. Sounds good. Thank you.
It's one thing to have an abnormality that you can hide with your clothes, but when you have it in the middle of your face, you can't hide it. I just hope that we can help him. Let's take a peek. Lower your chin for us. So this scar, so you have a big scar. This actually is not bad here, but you have that big scar right in the center.
Yeah.
So your tissue is a little tight.
Yes.
To me, what I think is gonna be the safest way to go, just so that we have absolutely no tension anywhere, is to put something called the tissue expander in your forehead. So what we would do, the first stage, is most likely make an incision up here, lift up the tissue,
Yes.
create a pocket for this tissue expander, put it down right in this area, and there'll be what we call a little port, a port that we can fill it, a syringe.
Okay.
It'll be underneath the skin.
Yes.
And then we're gonna come back, every week or 2 weeks and fill it up for you.
How big do you think it will get eventually? Like the size of a tennis ball? Or?
Probably maybe a little bit bigger than a tennis ball, but
Wow.
something kind of like that.
My immediate thoughts of having a tennis ball sized tissue expander in the middle of my forehead is a bit embarrassing. But at this point, I'm willing to do whatever I need to do to get the best results possible.